Next tonight, you might have heard some news about a new infection which is starting to spread in the UK. No, it's nothing to do with COVID. It's a virus called monkeypox. There are now 9 cases reported in the country. Now, it might sound worrying, but our health correspondent Catherine Jones is here to explain. Just a warning, there are some graphic pictures that are coming up. But Catherine, to start up with, what exactly is monkeypox?
Well, this is what monkeypox can look like. Yeah, not for the squeamish, really, is it? But it's not a new disease. It was first discovered in 1958, and it is related to smallpox. But before that freaks you out, that's actually a good thing, because it means that the smallpox vaccine also works to protect you against monkeypox. That also kind of explains why we might be seeing monkeypox now, because global routine childhood vaccination for smallpox, which would have also protected you against monkeypox, ended 40 years ago, and actually 50 years ago in the UK. So in parts of Africa, monkeypox is endemic. People tend to catch it actually from rodents rather than monkeys. And so the first case that arrived in the UK, identified 2 weeks ago, they had come from Nigeria.
And it's not just outside of Africa and the UK we're seeing other parts of the world.
That's right. We've got 9 cases in the UK, most but not all in London. Also 5 in Portugal now confirmed, 7 in Spain, 1 in Sweden, 1 in Italy today, and 1 in the USA, who's thought to have actually come from Canada. What is concerning is that not all those cases in the UK are related to international travel or indeed to each other. So there must be some kind of undetected transmission going on, some links in the chain we don't know about. Also, the majority of cases in the UK are men who have sex with men. Now, that doesn't mean it's a sexually transmitted disease. It might just be their close contact, but it does mean men who have sex with men are being asked to be extra vigilant.
I'm worried about the fact that it might be spreading generally in the community, and it's therefore really important that people heed those health messages that are going out. So if you get anything unusual, you seek help soon. But I'm not worried about the severity of illness that people generally experience when they get an infection.
OK, so what are the symptoms then?
Well, let's take a look at them. It's pretty mild stuff. It kicks off with headaches and fever, and then muscle aches, swollen glands, swollen lymph glands, and tiredness. Then, after a couple of days, you get a rash. It begins as spots that then become raised bumps. Here's kind of how they develop. Then they become little blisters that kind of crossed over and then fall off. It's kind of like chickenpox, to be frank. After feeling grotty for about 2 weeks, people generally completely recover and complications are rare.
OK, so how infectious is it?
It's spread with saliva droplets, so coughs and sneezes, but also contact with those kind of skin lesions. So direct contact, but also, for example, contaminated bedding, so close contact.
And what about authorities? What are they doing?
Well, they're tracking down, obviously, all the contacts of the cases that they have found, tracing those chains of infections. But also, remember what I said about smallpox vaccine being useful. That means if you find a case, you can offer the vaccine to a kind of ring of contacts around them. You've got about 9 days incubation period to get to those people, vaccinate them, and that stops those chains of transmissions going on. And that is also something the UK is already doing. The advice for everyone, particularly for men who have sex with men, is to watch out for unusual rashes and illnesses. If you're concerned, also ring ahead before you arrive at, say, a busy medical centre. The key thing, I think, to remember at this stage is the risk to the UK population is very low, and those public health teams are really well trained at stamping out this kind of thing.
So not another COVID, reassuring stuff, Catherine. Thank you.